Tom Aspinall's title fight against Ciryl Gane ended with a bit of a letdown after being ruled a no contest when Aspinall was unable to continue after what is certainly one of the worst looking, not single, but double eye pokes I've seen in the sport. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach more about the medical side of the sports world. And right off the bat, for any MMA fans watching this saying that Tom Aspinall quit, that he was trying to duck Gane, and that he knew he was going to lose anyway, so he just claimed he couldn't see, absolute, complete nonsense. There is nothing about what we saw here that should be regarded as him faking this or making this up. I don't care that one of his eyes was open during the interview. There is nothing about this that should be interpreted as him making an excuse or trying to get out of the fight. So let's talk about what we're seeing here with this eye poke. What you have to remember, right, a lot of times when we think of an eye poke and the more serious ones, we think about whether or not the eyelid was open or the eyelid was closed. In this case, for certainly Aspinall's right eye, it seems like his eyelid was closed. His left eye, it seems like that fingernail of Ciryl Gane does get underneath his eyelid. But what we also have to remember is it's not just about the contact to the eyeball itself, but also the direct pressure that is being applied onto the eye and what that can do in terms of pain and real trauma, damage, potentially vision threatening to the eyeball. So, number one thing that we're going to care about with an eye poke that's going to cause the majority of that immediate reaction is going to be something called a corneal abrasion. Looking at our biodigital anatomy tool here in a cross-section of the eye, looking straight on, the cornea is going to be the thin, sort of superficial layer of cells that are the first thing that your finger is going to come into contact with whenever you poke somebody in the eye. Whenever that cornea is injured, we call it a corneal abrasion, and you actually are tearing, damaging the cells that make up that cornea. Of course, if you have dirt on your finger, the fingernail, anything that's not like a perfectly smooth surface with any bit of little dirt or dust can cause a tear in that actual tissue making up that cornea. And what that's going to do is not cause necessarily vision-threatening damage, but it will cause your eye to tear up. It will cause this reflexive reaction where it is extremely hard to keep your eyes open because your body wants to protect your eye. And when it senses trauma, when there's damage to the eye, it's going to reflexively want to tear up to protect things. It's going to want to stay closed. And so is it that he physically couldn't? To a degree, yes. Sometimes those reflexes just cannot be overcome and you cannot keep your eye open long enough before your body and your brain say, no, we need to protect our eye, cover the eye with the eyelid to keep the eye safe. It also is normal that the doctor would say the eye looks fine. Whenever we're diagnosing a corneal abrasion, visually, when you're just inspecting the eyeball is going to look okay the majority of the time. The real way to diagnose this is to take something special called a fluorescein dye, put the dye drops in the eye, and then use a specific light to see where that dye tracks to know if there's a tear or a defect in the cornea, but you're not going to do that ringside in an MMA fight. And so, yes, a corneal abrasion, very real, very painful, uncomfortable injury that is going to affect your vision in the short term that will make the eye look normal. So we can't just say, well, the doc said his eye looks fine, that means he's faking it, because a corneal abrasion, the eye will look fine. Other things to think about: direct pressure to the eye, you can get something called a retinal detachment. So if we're looking again here, cross section, the retina is the layer of cells all the way on the back side of the eye that takes the light information and transfers it into this electrical signal to conduct along the optic nerve into the brain to register the signals from what you're seeing and transfer that to an image that your brain can interpret. Direct pressure onto the eye, direct trauma onto the eye can cause energy to transfer through the eyeball into the back layer of the eye and cause the retina to detach or tear. You can have an actual rupture of the eyeball itself. You can have enough energy and force put through the eyeball that the eyeball itself can rupture, called a globe rupture. There are other things, something called a hyphema, where you get blood that collects here in the front part, the anterior chamber, kind of layering in front of the iris, the colored part of the eye, and covering the pupil. And so this isn't just about did his eye look normal or not. We have to take into account the amount of pressure that was imparted onto his eyeball and not just visually what the eye looks like when the doctor inspects it. So as we look at this whole sequence here, yes, there are plenty of moments in part of this sequence where Aspinall could absolutely have sustained a significant enough eye injury to not be able to continue. I will admit, yes, here, first right when things are starting, the hand comes in. It looks like his right eyelid is closed, but look at all the pressure that is going through his eyeball. that pressure is going to cause energy to transfer into the orbit, potentially back into the retina, can cause a retinal detachment, which can be vision threatening. Then as all this continues, we see it also more pressure. Aspinall is trying to kind of move away here, but there's more pressure right there, digging those fingers further into the eyes. Continuing this whole sequence through, it still looks like his right eyelid is protecting the eye, but then we see on that left eye, again, look at the indentation that you're seeing where the eyeball is almost bulging out above from the finger going in below. And then as the finger kind of releases off, it does look like there was skin to eyeball contact, particularly there on the left side. So I don't want to hear any of this like one eye was open, the doc said his eye looked okay. This is 100% enough that you would expect vision to be affected. Remember though, the same injury is not going to affect everybody the same way. So some fighters, this might happen, their eye might respond in a way where they can keep it open, their vision is okay and they can continue. But if a fighter is telling you that they cannot open their eyes, they cannot then see things to protect themselves, and you have no choice but to end the fight. I don't want to hear any of this that he was faking or ducking. Very legitimate. Don't just think about the scraping on the eyeball. Remember that even though his eyelids were closed, the direct pressure being translated through the eyeball can cause trauma to the eyeball itself, trauma to the retina in the back of the eye, the vitreous humor can get injured. So plenty of legitimacy here for the eyes to be damaged. Diagnostically, they're going to, of course, assess his eye movements, make sure that the muscles are not injured that control the eyeball, make sure there's no tenderness for something like an orbital socket, a bone injury, and then they will probably do something like the fluorescein drops to look for a corneal abrasion. If there is a cornea abrasion, sometimes depending on the circumstances, they might use antibiotics, oftentimes just some pain medication, and these things resolve within a few days, maybe a week or two. However, if he is seeing things like floaters, his vision is going gray, or his visual fields are being affected, then they will likely get him to a hospital, do a deeper eye exam to look at the retina, make sure the retina is not peeling away, and do some further assessments. My best goes out to Tom Aspinall. I hope this is not anything that's going to affect his eye long term, because then if you get into situations where one eye has poor visual acuity, it can sometimes be not safe to fight in certain countries if the other eye doesn't work. We've seen that with multiple fighters in the past, and so hopefully everything checks out okay here for Aspinall. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.